Fabulous. Well, good afternoon, good morning, and good evening, everybody, and welcome to the third Climate Cast, as we're here and joined by our esteemed guests, Jessica, Robert, and Glenn. The focus for this session is around the nexus between climate and health, and we have an hour session today to inspire, engage, and enthuse, and really to build understanding of really what this nexus and what this interface really means with three expert speakers. So in true Climate Cocktail Club style, I'll just introduce the club and the Climate Cast, and then we have the opportunity to partake, if you have your ingredients ready, in a little mocktail, just as we can't meet in person, obviously, due to COVID, which is apt given that this focuses on health. So we'll see how that goes. So if anyone that hasn't come across us before, the Climate Cocktail Club was founded 2 years ago. It is a collective of individuals and groups of people across the world coming together to drive forward action around climate and sustainability. And we really reach out to that middle group of people we warmly call our climate enthusiasts. And I'm a chief kind of climate enthusiast within the organization, somewhat a climateholic probably as well, to really bring together inspirational speakers like we have today on topics that are really important that perhaps some individuals don't get a chance to hear from. And the Climate Cast really is our adaptation of the Climate Cocktail Club live events in order to be able to continue the drumbeat of the club and what we do through the virtual world. So I know it's not as good as being there in person and shaking hands, and as it would be today, probably spreading coronavirus, but we can still have that interaction. So I would love for all of you to be involved, to be engaged, as you have done in the previous casts, by posting your comments and posting your questions and posting on social media. That's really what makes this interactive. There's going to be an opportunity towards the end of the session for us to take questions from the audience, from clubbers. So please put those forward, and the team will be able to put them to the speakers. Also, following this session, we're going to be providing, as we do, a reading list of interesting articles, features, stories from the speakers, so you can really learn a lot about what is going on behind the scenes as well. So let me just move then quickly to making the cocktail, if I can. So I'm going to focus on here, and I've been really nifty in actually setting up something which should hopefully work out well here, which is a live cocktail cam. And I hope that this is going to work for us. So this is the Climate Beet cocktail as I've developed it. Now I've gone for the beet because it's currently growing in the garden, and I've been using it a lot of my salads. Much to the embarrassment of my former cocktail manager and hostess, I am not using my own made beetroot juice because I didn't have time and I wanted to do this. So what we've got here in the cup already made up is 2 ounces of grapefruit juice. I'm going to add some lime juice into here as well to put it forward. For anyone that knows me, I used to be a cocktail barman in a former life, so I hope I don't embarrass myself by just making this as a disastrous cocktail. We're going to put in a little bit of honey into that, a tablespoon of honey. This is a mocktail, but actually it works really well if you add in tequila into that as well, which I do wish I probably had in front of me. And then we're going to throw in a little bit of ice just into the shaker there so we can get it mixed up. Put in my ingredients to go in there, straight down, get the honey in. Normally I'd add a touch of warm water just to help the honey break down a little bit. Let's put that through. Then we're going to add in some of our beetroot juice, just enough to kind of get it up to the ice level. Hot pink shaker, very Tom Cruise. I'm not going to spin it above my head because it's probably going to land flat on my shirt. Oh, there we go. Fantastic beetroot there. Get my glass. Tequila cocktail, so I also used a hand-blown glass from Mexico that I picked up whilst I was over there as well. We're going to pour that in. Get my strainer straight down there. And then top up with a dash of ginger beer. So this is perfect. This is full of your antioxidants. Great for a little morning boost. So there we go, guys. This is the Climate Beet cocktail without the tequila, so mocktail. Can we taste it? I'm going to say it's delicious because I made it. And believe me, it is. There we go. So I hope you enjoyed. Thanks very much, everyone. So let's move on to the real guts of it. Now we've got that over and done with. Health and climate. So the health and climate interface has been a hot topic amongst environmentalists for decades, but certainly COVID-19 has thrown it fully into the spotlight. There's questions in our group for sure around, and in the media too, about the next big thing that may threaten human health. And I guess that's been coming thick and fast as we've been exploring extinction and biodiversity and what could happen in our healthcare systems. But actually, did you know that healthcare sector is responsible for about 4% of global emissions? And I certainly didn't until I read the work that was put forward and started engaging on this topic. And that's actually more than aviation and shipping, plus a host of other potent gases and waste streams, including the obvious single-use plastics, which seem to dominate media attention, but there's lots more other connections in that too. Healthcare centres, form part of the community. They're part of our safety net system, and I personally have a big attachment to it because my mum has been a healthcare practitioner, a sister in the NHS for over 40 years as well. So who we have gathered here today is Robert, Jessica and Glen, who are actually on a mission to inspire and transform the healthcare sector with a strong view of first, do no harm. So this session will explore the context for climate and health and communities and dig deeper into the industry and its ability to transform at a system level. So first of all, let me introduce the speakers as a whole, and then you'll have a chance to listen from each of them as they stake their claim and say the context in the scene. So first of all, we have Robert. So Robert is the Chief of Staff Innovation and Strategy and Head of Sustainability at Philips. As Head of Sustainability, Robert has been driving the company's strategy towards innovative, sustainable business models. And Robert and his team are leading the Healthy People Sustainable Planet program, which I may add just sounds like it encompasses everything, and probably your to-do list is bigger than most people that I know. And you're always busy, so I don't know how you have time to do your day job, which embeds sustainability thinking across all levels of the company. And they've just, Philips, if you haven't seen it, they've got a new strategy and research out as well, which is great, which we can follow up on our reading list. His background is in journalism, which probably makes a lot of sense for his presence on social media and his ability to talk and engage audiences, but also science and academic research. And before joining Philips, Robert worked at McKinsey & Co. as a consultant, where he gained experience in strategy and innovation, high-tech, healthcare, and public sectors. So very well qualified to be part of this. Next, you'll be hear from Jessica Wolf, who is the US Director for Climate and Health with Healthcare Without Harm, and within the practice Green Health as well. Jessica leads the climate team in developing strategies to engage and support the healthcare sector to work on climate solutions to become a leading voice on climate change, health, and equity. And her current position is the culmination of a career path split between healthcare and environmental sustainability. And as an environmentalist, business professional, and former nurse practitioner, which I found out when I was chatting to Jessica, which is awesome, frontline, Jessica feels grateful to be at this Nexus working for healthy people on a healthy planet. And there's a ton of stuff around equity and communities that we're going to unpack in this session, which I'll be prompting Jessica on. And then finally, last but not least, we have Glen Garrick, Director of Sustainability at Intermountain Healthcare. So Glen, Director of Sustainability, which is a large, and Intermountain Healthcare itself is a large healthcare system managing, which I thought, I worked this out. I was trying to put it into football fields and I just lost, the converter couldn't do this for me, but 1.6 million square meters. So that's almost 18 million square feet of healthcare space in the US. It is huge, unbelievable. His educational background is in green building certification. He's a master's in business administration as well, and over 20 years of healthcare sector work experience in supply chain, energy management, and environmental sustainability. So I guess if there's anyone that knows the guts of where the impacts are and how to reduce them, Glen's the man to answer that. So here are your speakers, and let's begin the session. So first of all, I'd like to introduce Robert into that, and let's hear from you, your context setting, the first 5 minutes.
Thanks, Tom, and hi, Clavers. It's fantastic to be back again. I had the pleasure to be in Amsterdam and New York, this time from the phone, which is, of course, much more sustainable. So great to be back. It's a very hot topic in every sense of the word, as Tom said already. And we see, of course, that both healthcare and environmental systems are under enormous stress these days. Just think of the 5 hurricanes that are on top of the Atlantic Ocean as we speak, or the bushfires that we have seen on the climate side, the enormous pressure that's on the healthcare systems globally with the COVID outbreak. I don't have to elaborate on that, but I think more importantly, it's to understand that these are not isolated phenomena, but that they are deeply connected. You referred to some of that, Tom. I think we hear more from the other panelists later today. Maybe just one other soundbite. The WHO, the World Health Organization, said that the Paris Climate Treaty may well very be the most important healthcare treaty of the 21st century. Yeah? So the World Health Organization speaking about climate, making such a statement, really shows the deep connection. My own father spent 3 weeks in the intensive care unit 2 years ago after a huge heat wave hit Germany. So we can feel it on a very personal level. We see it as a system level. We see what it does to the communities around us. And under the motto of doing no harm, increasing number of healthcare professionals are putting their shoulders behind it. Also, thanks to the fantastic work of leaders in the field, like Intermountain, or organizations that really drive and organize it, like Healthcare Without Harm. Now, at the Philips side, we have just launched our new 5-year strategy, really company strategy, making a commitment to step up on becoming a truly purpose-led company. So that's not just being a business with a purpose on the sideline, but it really means to live up to your purpose, improving people's lives through the means of a successful business. And I think that's quite a step, even for us, where we have quite a track record on that field. But so we have put some really tough targets to ourselves also for the next 5 years, both on the social and the environmental side. And without going into detail on the social side, as a leading health technology company, of course, Philips really can make a difference for all those people that do not have no access to healthcare at all. So we also focus on making healthcare accessible. 3.5 billion people, half of mankind, does not have access to healthcare, and I think we can play a role there together with partners. And of course, also keeping healthcare accessible, making the world work easier for the hundreds of thousands, millions of healthcare professionals that are working in the field under these difficult situations also sometimes. On the environmental side, we have committed to science-based targets, which is probably not cryptographic to the clubbers of the Climate Club. So we have set end-to-end, including supply chains, operations, and use phase. We want to commit to 1.5-degree global warming scenario, which is really aggressive. That has huge implications also on the innovation side. Of course, what we do, 90% of the impact is in the use phase. So that means really teaming up with customers, healthcare professionals, understanding how solutions are being used in practice, and enabling our customers also to reduce their environmental footprint through smart innovation that both addresses the material side and the energy side of things. Closely related to that, of course, the sustainable use of materials. We know that half of climate emission reductions need to come from circular models, so we really want to push that. By the end of this year, we will be able to take back all large-scale medical equipment globally, and we're going to expand it to all professional equipment in the next 5 years. Very ambitious program around eco-design. 100% of our new products will be going through that eco-design program under the new ambition. So there's a lot happening. And of course, it's truly inspiring, connecting the 80,000 people of Philips around the world, but also bringing us close to our customers and many other partners, including NGOs, because it's just inspiring to work on something that addresses some of the biggest challenges that mankind is facing at this point in time. That's where I want to leave it for now.
Yes. Yeah, thanks very much, Robert. I just made a note there to dig a little bit deep into eco-design, because that's a phrase that we hear about a lot. But unclear. So if I can move on to Jessica now. So your time, please. Thank you.
Thank you, and thank you for having me today. As Tom introduced me, I'm the U.S. Director of Climate and Health for Healthcare Without Harm. Healthcare Without Harm is an international nonprofit organization that was founded in 1996, and we work to transform healthcare so that it reduces its environmental footprint, becomes a community anchor for sustainability and resilience, and a leader in the global movement for environmental health and justice. We have regional offices and partner organizations in 10 countries and an international network of 36,000 hospitals and health centers in 60 countries. In the US, where my work is focused, we have a membership network called Practice Green Health, and that includes over 1,200 hospitals, which is about 20% of all US hospitals. We work with these hospitals to really aggregate the political, ethical, and economic power of the healthcare sector to advocate for clean energy and climate smart policies, and to accelerate the transition to a low carbon economy that protects health and promotes equity. And, hearing about Philips and their work really is inspiring and makes me feel like we can do this work, because it's going to take all of us working together to do it. Before I jump in with a little of my context setting, I just was talking to Tom ahead of time, and since this is an international audience, I do want people to understand that in the US, most hospitals are privately owned, and people don't all have health insurance. In fact, in 2018, about 9% of the US population was totally uninsured. And to get insurance in the US, if you're not employed, because most of our insurance comes from employers, can cost a family $10,000 to $20,000 easily. So it's a real crisis in our country of access to healthcare. So just some context setting, climate change is already impacting the health of all people. Depending where you live, you're seeing different harms: heat waves, extreme weather events like flooding, fires, or hurricanes, increased air pollution, food and waterborne illness, insect-borne disease, mental health stress. These health impacts are here now, and they will worsen dramatically in years to come. We are already seeing climate migration, and we'll see more people migrating as they no longer have access to safe housing, food supplies, and clean air and water. This year, as Tom referenced, we've been reeling under the impacts of the COVID-19 pandemic, and we are now seeing the convergence of these crises. COVID-19 has complicated the response to climate disasters and vice versa. So for instance, how do you safely bring people into cooling centers and maintain the social distancing that you need for COVID? How do we have enough N95 masks for the firefighters in California, Oregon, and Washington in the US, and also have enough masks for the frontline workers taking care of patients with COVID? And in both of these cases, the impacts of these crises are not being felt equally. Vulnerable populations with the least resources to respond, people of color, the elderly, the poor, are being disproportionately impacted. More people of color are getting sick and dying from COVID than white people, and these are the same people who already suffer economic and health disparities and are more likely to live in communities with polluted air and suffer from extreme weather events. In the United States, our history of slavery and structural racism is playing out at every turn. The health sector sits at the epicenter of the collective trauma of climate change, COVID-19, and racial injustice. Both COVID and climate are fundamentally about public health. This moment has also demonstrated that the health sector can be at the epicenter of collective healing. The sector anchors the response to the damage that we collectively face, as well as having the potential for a larger healing role in our societies. As we understand the factors that are making people sick are the social, racial, and environmental conditions that they face in their daily lives, we need to close the gap between healthcare and public health. We need to see the community as the patient, and we need to see the planet as the environment which sustains people's health. And I'm happy to say that hospitals are starting to understand these connections, and they're looking for solutions at the intersection of COVID, climate, and equity. So I have lots of great examples to share, and I look forward to doing so later in the conversation.
Yeah, great stuff. Thanks a million, Jessica. You could just have a whole session and more probably on that topic going deeper. And Glen, I'd like to bring you in now, please, for your perspectives.
Sure. Thank you for inviting me to this event. It's been really fantastic. And following up on Robert and Jessica is quite difficult. I've known Jessica for over a decade, and I'm proud to say she's a friend of mine and has been a strong inspiration. She really knows the healthcare sector in the United States very, very well, intimately well. My part, personally, Glen Garrick, as you know, I work as the Director of Sustainability, Intermountain Healthcare. To roll back the clock a little bit, previous to my time here, I worked for about 6 years in the healthcare sector in Africa, in South Africa and West Africa, trying to make sure the hospitals there were supplied adequately, which was a huge challenge. But I also had the, I don't know if I want to call it a privilege, but I had the responsibility of taking care of the waste. And that's where I really got my aha moment, where I really realized the impact the healthcare sector was making on the environment. Then I went and spent 3 years in southern Germany, again working in the healthcare sector and getting some experience there with the way healthcare is ran in Germany. Eventually made my way to Canada, staying within the public sector of offering healthcare. I worked in British Columbia for close to a decade for a couple different organizations. That's where I worked as energy manager, eventually into a sustainability manager, and then as of recent, landing here in Intermountain Healthcare as the director of sustainability. I'm fairly new into this position, but I came during a season of wildfires in Western United States. Just checked this morning. To date, there's been 77 significant wildfires, burning nearly 4 million acres of land. And as I look outside and I check the air quality this morning, and we are at a PM level of 2.4, which is yellow. They use a color coding system here. So the air quality is not great here today, and it's being affected by the wildfires across the Western United States. So to provide a little bit more context, drilling down a little bit, I really want to talk about how important it is to really realize the challenges and the struggles that key decision makers make. So Intermountain Healthcare, unlike most healthcare systems, is a not-for-profit healthcare system in the United States. And so every dollar is penny pinched, and it makes it very difficult. A meeting I had just previous to this one was a good news, bad news meeting where we decided to continue to reprocess our N95 masks, which was fantastic. Great reduction on waste. The bad news is the decision was made mostly because our COVID infection rate is skyrocketing. So it was a difficult meeting to have, but I'm glad we're continuing with that. And I'm hopeful that reprocessing will continue even once we start to get past COVID. Decision makers on the front lines, even within leadership on department levels, executive levels, are making hard decisions when it comes to dealing with budgets, dealing with pandemics, COVID, and dealing with the impacts of climate. And quite often, the impacts of climate, unfortunately, are being pushed to the back burner, because a lot of those impacts, unlike possibly the wildfires this year, are not being seen today as readily as the pandemic is. And when you talk about budget, I can tell you that my boss is very concerned about new entrants. Intermountain has presence across 5 Western United States, which is fantastic, but there's companies called Amazon and Walmart that are new entrants into healthcare, and they're putting a significant amount of pressure on organizations like Intermountain Healthcare when it comes to trying to provide healthcare at the lowest cost. So it's really a balance of trying to bring those priorities together and helping decision makers make long-term decision making.
Yeah, fab, Glenn. Like I've got a list now of questions that just reel off that one, and then the Amazon was a real curveball in there, which I hadn't kind of appreciated or acknowledged. But they're disruptive at so many levels and so many systems and sectors, right? Why not healthcare? So we can go to that as well. I do want to just have an obvious question, which I may just ask Robert to take if I can, just to start off with, because we talk about this health climate interface or the health climate nexus as it would be. But what does it mean, and why are they so closely related?
Yeah, it comes from both sides. I think we have heard the facts, right? You mentioned the healthcare industry globally is emitting more CO2 than the airlines together. So that is significant. Hospitals are often the most polluting buildings in communities. So I think there's a significant impact that the healthcare industry can have on the environmental health. At the same time, of course, also healthcare professionals understand that you cannot improve somebody's life or condition if you are destroying the planet at the same time around, right? So you need a healthy living environment. And on the other hand, we see also that the impact of climate on healthcare is tremendous, and you heard the example. So I think both are deeply connected, and we need to stop trying to solve these challenges in isolation. We need to take a step back and think about what does sustainable healthcare look like in the context of the bigger system, and that is the social systems that we are in and the environmental systems that define the planetary boundary conditions. Only then you can find lasting solutions.
Yeah, but this isn't new. The climate impacts and threats. This is something which it's been on the radar. And maybe just to pick up your point, Glenn, if I can just ask a direct question there, around budgeting being put on the back burner, thinking about short term a little bit on COVID, but not the long term trends that we're seeing in terms of climate related health impacts. Why is that decision making, or why is it a lack of understanding, is my public question, to those impacts and threats that are coming, or what is it?
Yeah, I would say it's a lack of understanding, but to be more specific, what is the lack of understanding? And it's around risk. So one of my first tasks was to connect with the department. There's a whole department involved around risk, and actually got one of their individuals assigned to the portfolio of environmental climate risk. This is a whole new area for the organization I'm working with. The previous organization I worked with had done a little bit of work in this area. But this is an area that just has not been prioritized. What is the climate risk on our facilities? There's work being done around asthma, for example, around the health impacts and how we're going to provide services, but there's not a lot of work happening around how a 2 degree, even a 1 degree change is going to impact the infrastructure and the HVAC systems of our sites. So the first thing, my road into the executive leadership team is to say, hey, this is a risk we need to think about and address.
Yeah. And then maybe a similar question, but framed to you, Jessica. That nexus is broader than just climate and health. I mean, we can play in equity, and we can play in equality into that as well. It's multidimensional, multifaceted. And then obviously it's based on location. It's based on the time of people's experiences, their access to different services around that. So for you in your work, then how do you engage and educate and inspire, I guess, a little bit around these issues to bring it to the fore?
Yeah, and before I answer that, just a quick comment to add to Glenn's. This idea of risk and how it's managed is really challenging. We put out a great paper called Safe Haven in the Storm, Protecting Lives and Margins with Climate Smart Healthcare. And that really made the business case. It looked at the cost of being unprepared and gave specific examples from health systems, and then looked at the benefits of investing in resilience. But for the climate clubbers, I would say there was just a great article in the New York Times about climate migration. And one of the very interesting things they point out is in many parts of the world, people are very connected to their food supply and their water supply. So as drought hits or as food becomes scarce, they move. Whereas in the US, we have created a system where people go to the most dangerous areas. And, a great example is Florida. So the property insurance companies are realizing they're in real trouble as Florida has everything: sea level rise, inland flooding, wildfires, insect-borne diseases, everything. So they started to pull out. So, Florida was so worried about the short-term risk to their economy that the state started insuring rebuilding in areas that are so vulnerable. So, this is a system-wide problem. And I think health systems are not being in the US regulated or having to really manage the risks that they're facing. So, everyone pointed out the healthcare's footprint globally, which is about 4.4%, of the emissions. In the US, it's even higher. It's close to 10% of emissions in the US, with hospitals making up a third of those emissions. So certainly hospitals are responsible for contributing to climate change, even though they're also on the front line of managing those impacts. On the flip side of that, and this kind of gets to your question, Tom, about how we work, is that healthcare's got an incredible opportunity to be a leader. So if you look globally, healthcare is 10% of the economy and 15% of the workforce. In the US, it's 18% of the GDP and 14% of the workforce. So it means we can really have an outsized impact on the economy. So we have to leverage the purchasing power of this sector to drive the transition to clean energy, to a low carbon supply chain. We also have to take these health systems that have purchasing power, but also political influence, and anchor institutions, and leverage that power. And healthcare can influence policy decisions at the federal level, state level, city level. They can tap into national and international healthcare organizations. And because they're the largest employer in communities, they can really make a difference there. So, yeah. Should I stop there?
Yeah, I was just going to pull in there, Jessica, because I do want to dig a little bit deeper about that system level change. And I think we're going to address that a little bit later on, because that's really where collaboration comes in. I think that's a point of optimism a little bit, if that's okay. Just to play back a little bit, what you all featured in your kind of soapbox moment. And this really was about climate related health impacts that we can see today that people appreciate. So Glenn, you mentioned about the wildfires, for example, and Robert, you mentioned about the heat wave in Europe and things. So outside of that policy context and your organizations, do you think that there is better understanding amongst the general public? And do you think that, like we've seen in other industries, when there's public awareness, there can be pressure that's put on industries to change? Where are we in terms of that that level of awareness and potential influence from the public? And that's open to anyone who wants to pick that up.
Maybe let me go maybe adding also to what Jessica just said. The healthcare sector is close and deep in communities, and there's also a tremendous proud and desire of people to do good and do no harm. I think that adds to the power that you were describing, Jessica. Yeah. Okay. So that was a remark to add, but the reply to you, Tom, it's about there's a difference between importance and urgency, right? I think everybody understands now, after many years, after Al Gore's Inconvenient Truth, that climate change is extremely important. But contrary to the impact of the COVID crisis, it is not felt still by many as an urgent problem. It is often referred to sea rise at the levels at the end of the century. So we have the illusion that we have a long term to act, which is not the case, right? I mean, we need to curve this in the next maybe 8 years or something. In order to do so, we need to take major decisions and investments in the next 5 years. And in order to do so, we need to have the frameworks, the understanding, the capabilities in the next 2 years. So we should have started, let's say, maybe 20 years ago. But so there's not a lot of time. And the discrepancy between importance, perceived urgency, and real urgency, I think, is what makes one of the challenges that makes climate change so difficult to tackle at scale.
Yeah, and I think perhaps the media has a part to play in that too. I mean, they are often able to choose the stories and how they're presented to the audience as well. And maybe it doesn't make that much good news to talk about some of these issues itself. I want to pick on an international aspect, Glenn, because lots of people will be dialing in and will have roles that are beyond the US. But just to dig a little bit deeper into that experience you had in Africa, and I've traveled there extensively, and I know Philips has a footprint there too in the work that you do. You know, waste is an issue, and I guess I hadn't really appreciated too much the waste that's generated from the healthcare sector. So just talk us through a little bit of that impact stream, perhaps focusing a little bit on the developing world in Africa. But I think we can open that up in the latter part of your response to what's happening in the US as well.
Yeah, well, I can give some context. Saying my experience in Africa was, almost 2 decades ago. So I'm just going to caveat that, saying that the systems there, I'm hopeful of, have improved quite a bit from when I was there in the late 90s, early 2000s. My time there was supply chain, specifically the waste management. And we had an incinerator, which was unfortunate, but the alternative was to send it to landfill. And one day I accompanied the waste hauler, which was basically a tractor and a big flatbed and a whole bunch of bags piled on the back of it, from our facility to the landfill outside of Banjul, Gambia. And I realized as I watched them dispose of this trash into the landfill that there was people living on the side of this rubbish dump. And my eyes specifically locked on, which I assumed was a mother. It was a lady and 2 small children next to her. And suddenly I realized that when we leave, they have complete access to this rubbish dump, and they will be digging through it and hoping to find something to sell at the market and buy some rice and continue their living. And that's when I realized that the waste we were producing was polluting the environment, and the chances of one of them breathing in, the incineration smoke or being possibly negatively impacted health-wise through the waste in the dump was actually quite high. Could I conclusively link it? No, I can't. But I think any reasonable person could say, hey, we are impacting the health on a negative level with the way we are producing and disposing of our waste. It was at that point that I started my personal mission to say, we need to reduce our waste. We need to reduce our waste, and then we need to dispose of what we can't reduce in a responsible way. Back then in Africa, it was very difficult. I expected a different approach in North America. Unfortunately, I wasn't greeted with that. The very first thing that I was greeted with was a contamination report where our rubbish had actually improperly been disposed of. So we had to make some changes there. So the work is ongoing for sure, even in North America as it is in Africa.
Yeah, it's interesting. It always feels a little bit like that's the hidden world. I know there's been a lot of work when we talk about supply chains in business, and there's lots of initiatives to get greater transparency on impacts in supply chain. And as I just come to think of it and listen to this, I haven't seen that many reports of supply chain initiatives and transparency in the healthcare sector. I guess I haven't thought about that because I haven't read it and I haven't seen it. So I wonder if there's a lack of focus on that aspect. Jessica, I want to pick up on a point just in the introduction. And I know this is something else you focus on, but communities, and we speak about disadvantaged communities in developing worlds often when in my world, we think about healthcare and environment, but there are disadvantaged communities in the US, in cities. What is it like living in a community, perhaps with no health insurance and limited access to healthcare? And I guess when we bring in climate, does climate compound some of the impacts and the livelihoods of those people? How does it all fit together?
Well, I think this is not a new saying, but we know that your zip code is more important than your genetic code in terms of your health. We have been creating a situation where we are citing the most polluting plants and toxic waste dumps in poor communities. We have heat islands in urban areas where the difference in life expectancy is significantly different depending where you live in a city. So these impacts are multiplied. And I think that there are solutions at hand. And I think it's a great opportunity for me to just share one because there's a community actually in Northern California, the cities of Richmond and East Oakland. And the poverty in these two cities is more than double their county averages. So people of color living in the flatlands of East Oakland live 10 to 15 years less than white people living 1 mile away in the Oakland Hills. I mean, that's dramatic to live 10 to 15 years less a mile apart. So there's an initiative that we co-lead with an organization called the Emerald Cities Collaborative that wanted to address the economic and environmental determinants of health in this area with a focus on expanding community wealth and ownership, improving health outcomes, and to strengthen the capacity of these communities to be resilient both to climate and economic disruption. So a key aspect of this is to bring the stakeholders, to bring the community to the table. And what they identified as a solution was to build resilience by localizing the food economy. So this fall, actually, after 4+ years, we're going to be opening a 50, not Healthcare Without Harm, but this project, a 56,000 square foot facility for food processing and meal preparation, along with a business food incubator. This work will serve 200,000 healthy, locally sourced, prepared meals that they're going to sell to hospitals, school districts, senior centers, and military personnel. And Kaiser Permanente and other hospitals and health systems in California invested in this and guaranteed procurement of these meals. So it's going to start with about 25 union employees. It'll grow to 250. There's a commitment to transition this to community ownership in the next 10 years. And they're going to source millions of pounds of locally grown sustainable produce. And one of the key interesting things is they have put in the ability to what's called forward contract with growers and producers. So it's going to help provide security for smaller operations that are often minority or women owned to be able to ramp up to provide to the institutional market because there's, again, a guarantee of procurement of their products.
Yeah, that's great. Robert,
I
do you want
just
to come
want
in
to
there?
say it's a fantastic example to show how you can solve multiple problems or address multiple problems if you really dig a little bit deeper and look at the root causes of it. And I think, yeah, Glenn, you made it this remark about waste in Africa and how to trigger your personal journey. So I think we need to also address it at multiple levels. Personal footprint, so to say, but also company footprint. So for instance, we have set us a target to put zero waste to landfill as of the end of this year globally from our own production. But then again, that's only a small part of what we can influence. So the impact with the hospitals globally is much bigger. So really helping and driving and inspiring a transition to access-based models in healthcare with healthcare equipment is a much bigger agenda. And one of the things, so that's the circular economy agenda of Philips, really. And that involves, again, innovation, making our products modular so that they can be repaired easier, providing, not selling machines, but enabling, for instance, diagnosis as a service in the longer run. So that are all ideas that can help to reduce waste and waste to landfill. And really at a systemic level, our CEO is co-chairing PACE, the platform to accelerate the circular economy. And one of the projects that we have been doing together with the Nigerian government and other electronics producers is to design together with the local parties a blueprint for electronic waste recycling in Nigeria that is also financially sustainable, with the idea to make that scalable across Africa. So there's a lot happening, and it's great to share these examples because maybe they inspire others also to follow suit and scale.
Yeah, and Robert, I was going to pick up on the eco-design element too. I mean, we see that in different areas, and I wonder here, what is collaboration like in this space? I mean, Philips leading the way, and you mentioned the PACE and the initiative as well. But are you collaborating with other competitors, peers, your supply chain, your greater ecosystem to ensure that all these parts can be moved together at the same pace?
Yeah, so ecosystem definitely, and suppliers also. And the clearer we are and where we want to go, and the clearer we can articulate it, the better our suppliers are able to help us. We have between, I don't know, 10 and 50,000 suppliers, depending on how you count them. But we have a very strong supplier sustainability program, including these purchasing elements that Jessica was referring to, the transparency elements that you were referring to, but really also building capacity with them, for instance, to improve energy efficiency in production. But some of them have also hundreds of design folks with specific eco-design capabilities. So if we tell them that we have a preference for recycled materials, for instance, or recycled plastics, and we make a long-term forward commitment to say we are going to source 10,000 tons of a specific type of recycled plastics, they have the guarantee that it is worthwhile investing these type of capabilities and facilities, and that's exactly what we do. So extremely important to team up, articulate, and wherever possible. It's a scale game also, right? I mean, circularity is not a product property, it's a system property. You need to organize around it, including the logistics and the business models.
Yeah, Glenn, 1.6 million square meters. I imagine your procurement list is pretty vast as an organization every year. What does that look like from a sustainable procurement perspective? What do you look for, and I guess where are the gaps?
That's a good question. One of the gaps I'm realizing very quickly with my new organization is, and I think it's fairly common across all healthcare organizations, is a lack of, how do I term this? Taking advantage of possibly the economies of scale, where they're a large organization and they can dictate a lot of the way the vendors provide supplies. And I'll give a specific example on that. One of the things we're looking at in tandem with Jessica's support is sustainable food procurement. And there are certain criteria around that to be defined as sustainable food, but our procurement team has never looked at that before. They procure food based on really largely the cost of the food. As long as a certain quality is achieved, it's really just about the cost. So when it looks like organic certification or whatever sustainability certification it may have, they don't consider that. It's not looked at. It's not a part of the criteria when it comes to procurement. So this is a gap. This is one of many gaps in procurement, but this is a specific gap that now I can turn around. And we do actually have a fantastic sustainable procurement team They are really eager to do this. They just need a little bit stronger leadership and guidance on what to do. And this is where we're working with Healthcare Without Harm and Practice Green Health to give us guidance as well, and saying, okay, this is how we can more effectively purchase food that is sustainable. And we need to set up these criteria, and we need to give credit to companies that have food that have these certification levels.
Yeah.
Can I jump in just for?
Yeah.
You know, I know your mom works at NHS, and, you know, they've really been a leader in this space. And health systems are behind higher education, they're behind corporate America, but we're just starting to get to our supply chain. And NHS is really leading that. They have, you know, put out kind of a notice to their top suppliers by spend that they want them to be reporting to the Carbon Disclosure Project. And these are the kinds of efforts we need to see. Yep. So, you know, I would also like to see some kind of, and it's been being worked on for a long time, you know, medical device labeling with energy efficiency, for instance. There's lots of ways we can impact purchasing. But I think Glen gets to the bottom line of things that, you know, our supply chain folks at most of our hospitals have been told, save us money. We don't care what you do, just save us money. And we need to put environmental criteria, low carbon criteria, social criteria into how they are evaluated. So it's got to go into contracts. It's got to go into RFPs. And we are launching this year something with the Healthcare Anchor Network, which is another organization in the US that actually Intermountain is also a member of, called the Impact Purchasing Commitment. And in that impact purchasing commitment, health systems that sign up will commit to a specific spend for minority women-owned businesses, a specific spend for local, and specific spends for and goals for sustainability, like renewable electricity. And it also looks at the policies and practices, because you need to have the systems and the processes in place to support that kind of work. We are about to launch with our Healthcare Climate Council, which Intermountain is also on. It's a group of 19 leading health systems in the US that have really committed to protect their employees and their patients from climate change and build resilience in communities. We're about to launch a project to look at Scope 3 assessments for health systems and to try to identify some key hotspots, maybe even down to a SKU level, where we think we can aggregate influence to really move those markets.
Yeah.
Extremely powerful. I just want to say really great to see that also, because that helps also companies to differentiate in the market, right? I mean, we have been working on eco-design since 25 years or so we have a strong track record, but we do that because we think it's right. But if our customers also say that we want it, it creates a competitive advantage.
And that was going to be my final question on this segment, Robert, just before we move on to some of the audience questions, was, you know, Philips is always put up there as a great poster child of sustainability, and I know you've done a lot of work on that. But in this example, it's your products and services. So where does the collaborative spirit of sustainability and the need to sell products, where does that interplay, and how does that work in this dynamic where what we've heard is actually it's often just about price?
Yeah, so I think it's very much about creating value, right? I mean, you know, the entire discussion in the healthcare systems also about outcome-based, value-based healthcare. So we need to get away from sick care and really transform it into healthcare, where public money is spent on keeping people healthy and out of the hospitals, ideally. And that also includes access-based models, if you ask me, and moving away from spending money on the wrong things, for instance, on repairing equipment that shouldn't be broken and so forth. So I think if we engage in systems where companies, suppliers, producers like Philips also provide integrated solutions, are responsible for uptime, for quality, first-time right diagnostics, and so forth, so you have much better incentives. It's just takes some time to organize healthcare systems in that way, and aligning also the reimbursement schemes in such a way that they drive better behavior, so to say, of the industry players. I mean, people want to. It's just that the economic incentives are sometimes totally misaligned.
Yeah. Okay. So I've got 3 questions here from the audience that I want to share, and I'll put each of them, one for each of you. Okay. So I'm gonna allocate them. Although there was one explicitly for Robert, so I'm just gonna address that first, just to let you have the mic, continuing, and just for everyone else is benefit here. So. This particular question, they're interested in how Philips has redirected the company's success metrics to include sustainability-based KPIs, and is success in this field considered on par with profit success, and is there an equal shareholder and management buy-in on these goals when compared to financial KPIs? So it's all about KPIs, management, monitoring, and then sharing success.
I think it's one of the pillars of a transformation program, right? You need culture, you need leadership, you need communication capabilities, but you also need KPIs and processes. So we have cascaded it down from the top. I could talk long about it. I will not. At the highest level in the company vision and our purpose, we have said we want to improve 2 billion people's lives by 2025. So it's a non-financial metric at the constitutional paper of the company, so to say. And from there, it really trickles down. We have sustainability indices, including how many people's lives we reach in underserved communities, the environmental performance, and so forth, and so forth. That's part of the regular performance review process tied to annual incentives, long-term incentives of the executives, all executives in the company. So it's an integral part of how we do business.
Yeah, great. Thanks, Robert. Next question, and this is going to be a sticky one, Glenn. So I apologise for throwing you into the deep end. But I think you'll be able to handle it. It's one that we get a lot, and it's not just about healthcare, but I think it's one that people like to get to ask. So, so do you think that large corporations are the solution to climate collapse, or the problem? And this is particularly pertinent given that the healthcare sector is such a huge contributor both to climate carbon emissions, but also the economy and jobs and communities. So, yeah.
Yeah, I saw that question pop up. I was wondering if we're going to get to it, and I'm glad we are getting to it. You know, honestly, I think large corporations, private sector, public sector, not-for-profit sector, yes, are part of the problem, but they are also part of the solution. They really need to step to the plate, be it Amazon, Walmart, be it Kaiser, be it Intermountain Healthcare, be it any large healthcare organization in the United States and the world. They are part of the problem, but they are the solution to the problem as well. And it's a matter of setting out a blueprint and a plan, strategic plan, to start to address the problems. Actually, the first step is to recognize that there is problems there, and then setting a plan together to address those issues.
Yeah. Which I guess isn't easy to do, and I guess part of that is collaboration, and what Jessica's doing in those initiatives is just great examples of doing that. And then,
Can I maybe comment? Sorry,
yeah,
Tommy, you just triggered me. You said it's not easy to do. I would fully agree and recognize it being in the field for quite some time. But it starts also with thinking about being aware of your material impact areas. So if you understand where and how you are polluting, and where you are and how you are having a positive social impact, not just on your patients, but on your communities, you can have a strategic discussion with the board of management. And it moves from just a risk topic or a Friday afternoon activity to some of the core parts of a health company or healthcare provider. And then it becomes really exciting. So I would encourage everybody who thinks about mounting a little revolution to understand, starting with the impact areas and really putting it on the agenda of the board.
Yeah, that's a really good point. Thanks for putting that forward. And one specifically for Jessica here. So this is around, I'll read out. So how do we make healthcare more accessible for vulnerable communities while investing in clean energies, proper waste management? And that's from Argentina.
Well, thank you for that question. And we actually have great work going on in Latin America that I can't speak to, but I can point that person to our Latin American region, where the hospitals are doing some wonderful work. But I think I'll share an example from a health system called Boston Medical Center, which is located in Boston, Massachusetts. And they're a safety net hospital, so they serve some of the most vulnerable patients. They serve the patients without health insurance, or patients that have a federal form of health insurance that does not reimburse at the level of the cost to the health system. But they have managed to become really a leader in connecting climate, health, and equity. And one of the things they've done from the energy perspective is they've installed a cogeneration plant, or a CHP unit, combined heat and power. And it has the capacity to do black start. So when the grid is down, the hospital can remain functional. But they tied it also as the backup for all of the emergency services communications for both Boston and the state of Massachusetts. The other thing they've done is they have a rooftop farm. and they grow their own produce. And this produce supplies patient meals, it supplies the cafeterias, but it also supplies their fresh food pharmacy. So they have a program where physicians can write prescriptions based on chronic illness, based on food insecurity, for needy families to go fill a prescription for fresh food from this pharmacy. So they are taking care of their community while they are reducing their climate footprint. And I think that shows you some of the ways that you can do that kind of work.
Yeah, and hopefully grow beetroots and their own stem ginger, and they can make themselves a beet cocktail next time. There's just one more question that I do want to put forward. I'm going to ask Robert to take this one on board, and just for the benefit of my team, it's around the CCS. So, and this is pertinent because lots of companies are making net zero goals, and we're exploring at a business level opportunities for carbon removals, technical carbon removals. So carbon capture and storage itself as a mechanism. Robert, perhaps you can talk to that if possible.
Yeah, so it is not so relevant for us, but it may be relevant for some other industries. So we have a very comprehensive carbon action strategy. We started with a marginal carbon cost curve, right? And then really looking at the economics of our own carbon footprint. By the end of this year, we are operating globally carbon neutral as Philips. We have our own wind parks. All of the United States electricity is produced in our own wind park there in the Netherlands as well. Power purchasing agreements in other parts of the world. So yeah, there's a lot happening. But carbon capture and storage, I think at this point in time, is not relevant for us.
Yeah. I do think that the question also noticed slightly for others, the health benefits, but I would just put in it's a nascent technology, and it's only ever going to be perhaps limited in its application in the short term. So it's probably not one that we're going to see on the radar too much. But look, with that, I want to bring the session to a close. So thank you all for participating, answering the questions, both for myself, each other, and then the audience. So thank you, Glenn, Jessica, and Robert. And I'd also like to thank Natural Capital Partners, who are our global climate partner for the Climate Cocktail Club and have been supporting with the Climate Cast as well. And Jessica also mentioned about Kaiser Permanente in her message, and they've recently made an announcement around carbon neutrality as well. And I think that's a good case study in the industry that we can link to as well, through Natural Capital Partners. So thank you all once again. I hope you enjoy the rest of your day. Just for anyone that wants to continue to follow the Climate Cocktail Club, please do so on social media. Please subscribe, and please watch out for the next events. And the next event is coming up on the 8th of October. And maybe it will have a beetroot or two, because what we're going to be looking at there is the regenerative generation. So looking at that focus inwards into communities and households and how they can be more sustainable themselves, green fingered, dirt under the nails, and everything else in between, but also looking at some of these other points around business and organic soils and how we can all collaborate together to a more regenerative future. So that's on the 8th of October. Once again, thank you very much to Glenn, Jessica, and Robert. Have a great day and enjoy the rest of Climate Week. Goodbye.
It's a pleasure. Thanks, Tom.
Hey, thank you,
everybody. Bye.